Hi, my name is Gloria Fry. I'm currently in English 111. I have decided to do my presentation on patellofemoral pain syndrome, which was what I did my informative paper on. Patellofemoral pain syndrome is a severe to mild pain or discomfort that originates from the posterior part of the knee into the femur, or the patella to the femur. Patellofemoral pain syndrome is more common in women than men and is typically found in the age groups of adolescents to young adults. Symptoms of patellofemoral pain syndrome are dull aching pains in the front of the knee, catching or popping, and even maybe grinding sensations when walking. There could also be swelling caused by the breakdown of articular cartilage. Pain in this syndrome is caused by inflammation of the synovial membrane, erosion of cartilage and bone, irritation or injury to the soft tissues of the knee. Also, external factors such as incorrect running shoes, increased training load, and also the training surface. Diagnoses of patellofemoral pain syndrome or the diagnosis of the syndrome would include extensive exam of the knee or knees from a doctor or orthopedic doctor. This may even go as far as to get an X-ray or an MRI to make sure that there is no extensive damage done to the knee, such as a tear or the tendons or anything like that being torn. Treatment options for this particular syndrome are to avoid putting your knee in any kind of position that would hurt it. A lot of those which would hurt your knee would be in a sitting position, squatting, kneeling, going upstairs, anything in the such a matter where you bend or put stress on your knee. Also, you could take an anti-inflammatory, which would be over the counter, to reduce pain and swelling and inflammation, of course. You could also do ice therapy, physical therapy. You could use tape or a brace to stabilize your knee. And there are also a lot of surgeries out there that you could use to fix if none of those other things help and you still experience pain, although the surgeries are not that great of an outcome. The ice therapy you would use to apply to your knee, of course not directly, but you would apply it to your knee every 15 minutes or for 15 minutes every 2 hours. So what I'm going to do now is I'm going to show you some of the tape and the braces that you could use to stabilize your knee to help and reduce pain and inflammation. So one of the first braces or something that you could use to stabilize your knee, which a lot of people would know, would be an ACE bandage. You could take this and wrap it around your knee to support it. It's not going to give you that much support, but it would give you some. Okay. Then you have a brace such as this, which is going to have rods that would bend right here that is actually going to sit on the side of the patella and keep it in place. So this is a very good one. And then you have what I talked about a while ago, which is the tape, which with this syndrome is more or less the most common thing to use because the more you immobilize your knee, the worse it's going to get. So you would have the bottom tape and then the top tape because this top tape is so strong that it can pull off your skin. So you always would want to make sure that you use both of these. And this right here is strong enough to hold your knee in place, but also allowing you to move in the way that you should move. So that's what I've done. The reason why I chose this as an option for my paper and my presentation is because I myself suffer from patellofemoral pain syndrome and I thought it would be a very good thing for me to present. So thank you for your time and I hope you enjoyed.